Hey everybody, this is Francesco Abbruzzino with the Road Rant. Today I want to talk about big pharma and drug companies, but from a different perspective. I want to look at what they're creating and the business they're in. I'm not going to focus on the end product of what happens when a doctor starts throwing the product they produce, like pain pills, down somebody's throat to fix a problem instead of trying to find out what the real issue is. So we look at drug companies, and I do this all the time. I call them the big pharma, and they have this big bull's head on their head, target on their head here in America. And a lot of times they deserve it. If you just look at EpiPen and the issues that we've had there just recently, where they raised the price through the roof, or the little weaselly looking guy, Martin Schreckle. He raised his price of Darapin from $13.50 to $750. He did little, if anything, but give a smug reaction about it. And I see this all the time. I'm in the medical industry. I see it on medical equipment pricing, on services, drugs, everything. There are bad guys in life, and there certainly are bad guys out there with pharmaceutical companies. I get that. And those two are a good example of being a bad guy within that industry. But what we have to realize is that making drugs is a business. And like all manufacturers, drug producers find something that people want, that people need, and they produce it. That's what free market capitalism is all about, essentially. They go out there, they create sometimes life-saving drugs, or drugs that simply just improve our health. Blood pressure medicine, great example. There's a value in it. They are needed. So drug companies, they go out, they spend billions of dollars over many, many years developing this product that they feel will be useful. A needed product, and they go out and they try to improve them so that they will meet or surpass the FDA's strict standards. And once they're approved, they go out and market them. Makes sense, right? But this whole process is extraordinarily expensive, and it's time consuming. The average cost to bring one drug to market is about $2.6 billion. It takes an average of about 15 years from the time the drug is developed and first begins testing, a new formula, until the FDA essentially approves it. And even then, only 1 out of 1,000 drug formulas will ever enter the preclinical testing. And roughly about 8% of those will receive the ultimate FDA approval. It's a process, folks. The FDA is one of the biggest reasons that the price of drugs is so high. If you really want to get down to the bottom of it, the bare bones. And the exorbitant barriers to new drug entry have made it astronomically worse with the introduction of Obamacare a couple years ago. You can look at it, you can say, let's take pharmacy XYZ here. And they go out and they create 100,000 drugs out there, 100,000 formulas. But only 1 in 1,000, about 100 of them, will proceed on and go to the preclinical testing. And only about 8 of those will receive FDA approval. Yet they're investing billions of dollars into these drugs that will never get the ultimate approval. And so the company has to go out there and they have to sell enough of these and to make up the money just on those 8 drugs for all the development that included the discarded formulas that were never approved. And to have enough left to finance their new research, new development, and their profit. So just like other inventions, drug companies patent their products. I get that. It makes sense. And they do it for, an exclusive amount of time. And that patent is issued for generally, 20 years from the date of filing. And they usually file early in the development stage to protect their ideas and to protect their company. It takes them an average of 15 years to get a drug through approval and marketing. And it takes about, another average of 5 years to sell enough of the drug to recoup the $2.6 billion they had spent in development, marketing, and approval. At the end of the patent period and the exclusivity period, another drug maker can go out there, they can produce the generic version of it and sell it for a lot less. Another aspect of the issue is when drugs are made in the U.S. companies in the U.S. and they cost more here than in other countries like in Canada. It doesn't mean or it doesn't seem right that the Canadians get a discount on drugs, American drugs that are made here, but they get it a lot cheaper there. But you have to look at why, folks. In Canada, the government's coming in. The government is buying millions of dollars worth of the product at a lower than market price. That doesn't happen here in the United States. Essentially, the pharmacy is buying the product, and they cannot match the quantities that a government like Canada's government is going out there and purchasing. And there's likely other drug companies that have stepped in that can treat the same disease, and they step up to the table and they say, hey, look, this guy's offering it at a lot lower price. Why don't we go for that? So what are you going to do? As a pharma, big pharma, you're going to go in there and lower your price so that you can try to stay competitive. And that's just another obstacle. Another one is the ability to recoup the cost, to bring this new drug to market through regulations that are imposed by other countries. And a lot of times these other companies are introducing regulations to protect their own companies within their country. And so despite all the rigorous development and testing process that's required by our FDA and the approval process to make the drug safe for public use, the required warnings about potential side effects and such that we see on the TV, they list them all at the end of the commercial, the product sheets, the fact that drugs are prescribed by patients, doctors, drug manufacturers still are getting sued by the patients for these. And in short, they're kind of being squeezed at both ends. So for a lot of companies, doing business here in the United States has turned into a real challenge. A real challenge with all the regulations. They're burdensome, unreasonable regulations. And it's not just big pharma, it's throughout the business industry. And then there's the other hurdles that businesses have to negotiate through. And that's why making and producing the drugs that are needed and wanted here in America are so expensive. And so you got to sit there and think, it's no wonder big pharma has this major lobbying firms out there in the DC on K Street. And efforts are aimed at creating a more favorable condition. But that's called cronyism. It's not called capitalism. And when you put big government and big business together like that, you have the reason for expensive medicines. What say you? This has been Francesco Abbruzzino with a Rogue Rant.